It's now my pleasure to introduce Dr. Marius Geanta, President and co-founder of the Centre for Innovation in Medicines in Romania and trustee of the FH Europe Foundation and also chair of its Policy Advisory Committee. A warm welcome to you, Marius. Topics, really hot topics for you, are personalised prevention and precision health. Why are these concepts so important, and what do they mean in terms of the behavioural change that we're all seeking? Please, the floor is yours.
Thank you, Nicola. Thank you for the introduction, and I'm very happy to be here today. Actually, 4 years and 9 days, I attended in Bucharest, where I used to live, the FH charity at that time, annual meeting. And of course, we're like 4 times less people in the room at that time. And the topic of my presentation was how to set the agenda for health and what is the role of NGOs and not-for-profits. So it looks like my presentation was an inspiration. Because now, after 4 years, we have a big interest at the European level for health in general. We all know the developments in the cancer field, body developments, and James Kennedy presented what is the landscape or the policy landscape for cardiovascular health. So I'm very happy, and a few weeks after the meeting, Magdalena called me and asked me, Marius, would you be interested to join FH Europe? And I said, if I can do for CVD, CVH, what I did for cancer, yes, of course. And we are here today speaking about cardiovascular diseases and cardiovascular health. And I'm very happy to say that in all these 4 years, actually FH Europe Foundation was ahead of the curve. And we always have been able to predict what will come next in terms of science and in terms of policy. And I'm here today to tell you that the puck will be in the field of precision health in the years to come. And my presentation today, hopefully will be a very short one. And I would like for you to, at the end of the presentation, to be very clear on 3 definitions. Definition of health, definition of personalized medicine, and definition of personalized prevention. So, the definition of health was actually put forward by WHO in 1948, 75 years ago. And the definition goes that health is a state of complete physical, mental, and social. So in order to say about a person that is healthy, we should take into consideration not just the physical status, but as well the mental and, very important, the social dimension of an individual. A question that actually the patients are addressing to a doctor is, the doctor, why I actually become sick? What is the reason? Why I have been diagnosed with a cardiovascular disease? And depends actually who is the person who you will ask, because you will receive answers like air pollution, smoking, genetics, access to care, to doctors, poverty, or climate change, and of course could be other answers. And all are correct answers. The idea is that none of each of the individuals has the complete answer. And the idea is to be able to think and to put all these things together. And this shouldn't be like going to the Mars and back, because we all know, and I studied for 3 years public health, we all know what are the health determinants, what are the factors influencing our health. And as you can see, 22% are biologic and genetic factors, 11% is the health sector, and we are used to look to the health sector in order to identify opportunities and so on. 7% is the environment, and 60% are individual and social factors. So coming back to the definition of health, it's very clear that the social dimension and the individual dimension of health is not taken into consideration at many levels of the health system and healthcare sector. The definition of personalized medicine was put forward by the Council of the EU in December 2015. I have been part of this process, but I think the best example to explain the definition is to take what James Kennedy said before about breast cancer, a lower mortality than the CVD. And I think the breast cancer is the best example on how personalized medicine should be implemented, because we can speak about personalized medicine in prevention of the breast cancer, BRCA1 and 2, and Zamfina already mentioned Taiwan genomic indication, and there are as well other genes that can be identified, and women can benefit from a preventive intervention, as well in the screening. Precision diagnosis is, you cannot imagine the breast cancer management without precision diagnosis. And in the last 20 years, a lot of targeted treatments and now immunotherapies actually lead us to a 95% 5-year survival of the breast cancer. So comparing to this, and if we are looking to the cardiovascular diseases, we cannot see, except FH, we cannot see the same approach of personalized medicine. So in overall, cardiovascular diseases are so imprecise, in fact, except FH. And that's why I'm very interested in this topic, because actually FH can be the demonstrator of the value of personalized medicine in cardiovascular diseases and cardiovascular health. Moving forward to the prevention, I hope I'll not be too didactic, but we know that traditionally we have primary prevention and intervention implemented before the evidences of the disease. Is the secondary prevention then an intervention implemented after a disease began, but before it is symptomatic, and tertiary prevention interventions after the disease occur. The idea of the personalized prevention is to look actually through the lens of the health determinants and through the lens of data. And we have seen earlier today what is actually the power of data. And if we consider this path from the birth and during the life course, as well the natural course of the diseases, we can see that we have promotion, prevention, risk diagnostics, and treatment. And is this part of early detection that is of a particular interest for FH? And if you look to the type of data that can be used, and this is a frame provided by the Prophet study, who is looking to build a roadmap for personalized prevention by 2025. So if you look to the data required in order to perform an early detection program, you can see socioeconomic data, cultural data, environmental data, lifestyle data, of course, biological data. So my point is that we should think to the new programs of prevention and early detection for FH and other inherited lipid disorders beyond the biologic and genetics, and to take into consideration the individual and societal factors. This is just a frame putting together types of prevention and the data that can be used. And for you to maybe to better understand this concept of personalized prevention, this is an area data-driven that can intersect the 3 traditional types of prevention: primary, secondary, tertiary. The main point here is to be able to generate and to use this data and to build new models. And I refer to these new models soon. So this is the definition put forward by the Prophet project. I had the chance last month to be part of the stakeholder meeting in the Prophet project, and I have to say that I put the topic of the FH in the context of this, and as well the European Partnership for Personalized Medicine was launched the same event in Valencia, and this is an opportunity as well for FH, and especially for the patient involvement. One of the keys in order to generate data is actually to build new models, as I said. And my group in 22, we built this matrix of personalized communication. What is actually the idea? And this can be used in order to improve the education, the policy, the advocacy, anything. The idea is that each of us is actually surrounded by mainly 3 circles. You know, the inner circle or the microenvironment are family and close friends. Then is the meso environment, and we have seen in the course of pandemic how important was this, especially in rural areas and so on. And is the informational space, where the infodemia, misinformation, disinformation, and all these kind of things are actually influencing our decision. And the key point at the individual level is to understand how actually this attitude and perception, and I was very happy to hear from the European Medicine Agency presentation that they consider attitude and perception of the patients as a key component of this, and they are interested to generate data on this. So it's very important to understand how actually this attitude and perception are built, what are the influencers, what is the role of social factor or cultural factors, and so on. Of course, we can discuss a lot about this model and how this can be adapted in different environments. The power of personalized communication has been proven in the context of the pandemic, but in the context of the monkeypox crisis. And if you didn't hear anything about monkeypox crisis in the last 6 months, it's because the crisis was solved applying a personalized communication and engagement plan with the targeting the communities. So it's a very good example on how to deal with these very, very complex issues, because everything is complex in the healthcare sector. Yes, it is. And the idea is we are usually thinking in general in a very linear way. But in fact, the life is much more complex, and the health system is complex. And Professor Wigman explained us how complex is actually FH, right? And the idea is to start thinking from this perspective of complex system, but not coming in the, to the target groups with complex messages, but to be able to think in a complex manner, but to deliver the right message, maybe a linear one. So this is the idea. And in order to navigate this complex system, and this is a discipline itself, we need social scientists and social sciences tools. And one of them is the personal network analysis. The spread of obesity in a large social network over 32 years. So this was published by New England Journal of Medicine 2007. And you might ask, obesity, it's a disease, it's caused by a virus or by a bacteria, it's an infectious disease, or what? What is the problem? The idea is the following. In the famous Framingham Heart Study that started as well in 1948, 75 years ago, some social scientists, they measure the personal network of more than 2,000 individuals. And they have been able to follow them about 20 years and to define this network based on their interactions. And in yellow are the obese person. The bigger the circle, the bigger the body mass index. In green are the people who are not obese. And you can see the links between different individuals. The purple means a very close relation between individuals. And the idea is the following. If you are in a very close relationship with one or two obese person, and we know what are the determinants of obesity, the probability for you to become obese is very high, and vice versa. And this is opening a window of opportunity by understanding this to come with very concrete interventions. The problem is that this study, Framingham Heart Study, started 75 years ago, but this is the only publication on personal network analysis of the people in the study. So we have like 75 years of missed opportunities. And in the meantime, were thousands of papers, of course, super relevant on biologics, on genetics, other factors, and so on. But we missed a lot of opportunities, and this should not be happen in the future. To make things even more complicated, I think if we'll be able to apply this personal network analysis at different layers, at the societal level, and as well at the stakeholders level, then we'll be able to build this multi-level network analysis that will help us actually to be more efficient in implementing different programs in the public health and in general in the health domain. So this is my conclusion. The precision health anyway looks good, I think, but we are now in the transition from one size fits all, at least in the field of cardiovascular health or diseases, to hopefully to pret-à-porter or haute couture, and I'm sure that with FH we are in the middle, I think now, on pret-à-porter, but haute couture could be this network medicine that is part of a proposal FH Europe is contributed to, and finger crossed for the evaluation by the reviewers of the European Commission. So thank you so much.